Hello, and welcome to the Planetary Health Lecture Series. This module focuses on the role of environmental health in planetary health. I'm Dr. Shannon McMorrow, a U.S. Fullbright specialist to Naresuan University Faculty of Public Health, and my home institution is Western Michigan University. For this module, we'll talk about environmental health and also planetary health and how they are related. The objectives for this module are to first define environmental health, define planetary health, describe the impact and harm done by humans to the environment, explain impacts of the environment on human health, explore examples of planetary health in Thailand, and finally, discuss prevention strategies. So first, the Environmental Health Division in the Faculty of Public Health focuses on the interplay between the environmental factors and human health, aiming to prevent and control environmental hazards that affect community well-being. Planetary health is the interdependent health of human civilization and the natural systems on which it depends. Planetary health recognizes that human health and the health of the planet are completely interconnected. Planetary health is not new. The idea and the approach has been around for thousands of years from different indigenous communities and from different traditional approaches. But it has become popular and made a new discipline within public health in the past 10 years. So there was a report in 2015 by the Lancet Commission on Planetary Health. There's a link available if you want to read the report. Something that is important is to know that planetary health is interdisciplinary. What that means is that many different disciplines must work together to promote planetary health. That includes the disciplines in the Faculty of Public Health. So this module focuses on environmental health. We also have community health, including the aging and elderly population, occupational health, and applied Thai traditional medicine. All of these can work together on the social determinants of health, the ecological determinants of health, and then finally focusing on planetary health and getting all of the sectors to work as a team. Whenever we're talking about planetary health, it's important to recognize that it relates to many of the Sustainable Development Goals. So here we have all 17 of the Sustainable Development Goals. For environmental health, these are the Sustainable Development Goals that are most relevant and connected with planetary health. So you see environmental health, we focus on clean water, responsible consumption and production, life below water, life on land, and then climate action. One key part of planetary health is knowing that humans are harming the planet and also harming the environment. So what you see listed there are the areas that humans are doing harm. So having a high population, deforestation, so cutting down trees and not growing new trees, loss of biodiversity, so different species becoming extinct, both for plants and for animals, habitat destruction, so when we clear different forests or we harm water like rivers or lakes, we destroy the habitats of other animals on the planet. And then finally, overconsumption of natural resources. So that one in particular is important for us to recognize that as individual people, we can work on sustainability and not consuming so many natural resources. And then there is negative impact from environmental factors on human health. So when we do damage to the planet, it also damages human health. So there can be respiratory health problems, cardiovascular, increase in infectious diseases, chemicals, extreme heat and cold in different regions of the world. The supply of food and water may be contaminated, or there may be food or water insecurity. There can be negative impact on mental health, and then also a range of cancers. So this picture helps us have a view of how all of the different areas and systems are affecting each other. So the outside you can see is the green, and these are all of the different areas that we are having negative impact on planetary health. So you see on the left, surface temperature, weather patterns, biodiversity, and then you can see all the way around many of the different impacts. And then the next circle, the dark blue, are the different areas where we as humans have been damaging the planet, and also where we have the opportunity for improvement, an opportunity for interventions in public health and environmental health. So you can see again on the left, food and agricultural systems, governance, policy and practices, attitudes and value systems. These are all areas where we, as environmental health students and professionals, can make a difference to try to improve both planetary health and human health. When we talk about planetary health, one key part is climate change. So this slide reminds us of some of the specific problems and health outcomes that come related to climate change. So respiratory problems, there can be an increase in air pollution, like we see in Thailand. There can be an increase in allergens and things that make people allergic. There can also be an increase in pollen that is circulating in the air and makes people have more respiratory illness. Also more foodborne illness, more waterborne illness, because of the different kinds of changes from climate change in weather patterns or heat. This can give an increase also in vector-borne illness. So we have the illnesses from mosquitoes, and when we see weather changes and more water or more heat, then we see more mosquitoes, which can bring more illnesses that the mosquitoes spread, like malaria. Also food insecurity or less nutritious food. So as we damage the soil, there are less nutrients inside the soil. And then when we grow the food, it has less nutrition for the body. We have also seen research in environmental health that looks at mental health and stress-related disorders that are coming from some of the climate change impacts. So as we see more heat and as we see more natural disasters, we see more worry and stress in some populations. And then finally, the weather. Having the extreme weather, like the tsunami or the hurricane or the heavy rains, they can have impact on the healthcare system. So they can damage the infrastructure, so destroy buildings, destroy hospitals, and that also makes a negative impact on healthcare service delivery. This one also tells us the same thing, but it gives us a picture to better understand. So the yellow part at the top talks about vulnerability and the different areas of vulnerability factors, exposure pathways, and health system capacity and resilience. And then below that, in the blue, is the climate sensitive health risks. So there we can see, again, many of the different health risks that we already mentioned. I think you can also see there are some additional pictures. So we can see the heart for non-communicable diseases. This is another area that when we have the impacts of climate change, then there can be more heat and people do less exercise that can impact cardiovascular disease. We also may have connections between poor air quality, air pollution, and increase in non-communicable diseases. So what we want to do for environmental health is expand our focus and expand the interventions to also include planetary health. So not only do we want to look at environmental conditions, we also must see how is the environment changing, especially with climate change and especially with some of the damage that humans are doing to the environment. And we specifically want to make sure we recognize something called the Great Acceleration, which is recently, only in about the past 100 years, this is the time that the damage has been done from humans on the environment. And we really need to focus on all areas, so the oceans, the atmosphere, and the land. When we look at Thailand specifically, we see there have been some important actions by the central government, also by local governments. So what you see on the screen is Thailand's National Adaptation Plan, and that is recently, just from 2023, looking at what are different areas that Thailand can adapt to be better prepared for the impact of climate change. And the plan aligns with the Sustainable Development Goals that I mentioned earlier. In particular, Thailand is vulnerable related to the water. So some of the areas that are a top priority in the adaptation plan are looking at risk for floods, looking at droughts, and then also the sea levels rising. Thailand is improving. So in 2016, it was in the top 10 of countries most affected by climate change. Now, there have been many improvements, but it's still in the top 30 in the world. So it should be a top priority for public health students and also public health professionals to work on planetary health and reducing climate change to continue to make progress for Thailand. Some other work that is going on is good for you to review and find out more about. So what you see on the screen are a couple of different reports and research that are already going on by different researchers in Thailand. So we can see the top one, we see the map of Thailand, and we also see some of the different kinds of research that has been happening again, focused on the water sector. So looking at trying to address the increase that we have seen in flooding and the hazards and the damage that can come to communities from more flooding. And so one of the areas of focus is sustainable water management. And some researchers, so the paper you see on the screen, I'll also give you the link to read more, but some researchers are looking at nature-based solutions. So trying to work with the things that already exist within the natural resources in Thailand to see how to conserve, but also protect as flooding increases. One key area is to work with the local communities. So when working on these different interventions for environmental health, we want to make sure that we work directly with people in the communities. So here's a summary of the key lessons of our module on environmental health and connections with planetary health. First, we want to make sure it's urgent and important to focus on Thailand as it faces harm from climate change. For environmental health, we want to expand our focus to planetary health. So not only looking at environmental conditions, but also making sure we are following the environmental changes that are happening so fast from planetary health and climate change. And then also a reminder that it is interdisciplinary. So environmental health has a lot of knowledge and skill for working on planetary health, but it must be in the team and working with other disciplines. And then finally, collaboration and multi-sectoral engagement. So even in addition to public health and environmental health, we want to make sure we work with our other sectors like education and agriculture and economics and renewable energy, all of these sectors working together, like you see in the image, to be working on improvement for planetary health. Thank you. That's the end of our environmental health module.